Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Another reminder, after the pep talk, please take the online Learning Cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate as shown here. The link has been placed in the chat box. Another reminder, 50 OLETE certificates would entitle one mentee to a free voucher for a ROJoson telemedical consultation. A request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Where is my Ready? 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Prostate Cancer Awareness. This is in consonance with the DOH, or Department of Health, Health Awareness Calendar, in which we celebrate the Prostate Cancer Awareness Month in June. The empowerment objective is for the lay people to have an essential understanding of prostate cancer in their health management. The following are the contents of this pep talk this afternoon. When and what is the Prostate Cancer Awareness Month in the Philippines? What is the current disease burden of prostate cancer in the Philippines? What is the prostate and its functions in the human body? What is a prostate cancer? Who are at risk of having prostate cancer? What are the symptoms? What are the diagnostic tests? What are the treatment modalities? And what is the prognosis? What are the screening guidelines for prostate cancer? And the last issue is, can prostate cancer be prevented? So I'd like it to have a disclaimer here that my pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from experiences of other professionals and myself. First topic, when and what is Prostate Cancer Awareness Month in the Philippines? For this year, it's in June. And the main purpose of the Prostate Cancer Awareness Month in the Philippines is to raise awareness of prostate cancers in terms of what they are, kung ano sila, how to recognize, how to diagnose, screening recommendations, how to screen for prostate cancer in those without symptoms, and then diagnostic tests, treatment modalities being done, and prevention methods if there are effective methods. What is the current disease burden of prostate cancer in the Philippines? At the moment, prostate cancer is the third most common cancer in males after lungs and colorectal cancer. As we all know, prostate cancer only occur in males. That's why the statistics will be on males, and prostate cancer is the third most common cancer in males. Number one is still lungs, and then number two, colorectal cancers. What is a prostate? A prostate is a gland. When you say gland, it's an organ which secretes a particular chemical substances for use in the body. A prostate is found only in males as part of the male reproductive system, which secretes fluid that mixes with the semen, keeping the sperm healthy for conception and pregnancy. It is located below the urinary bladder and in front of the rectum. This is the prostate gland. A prostate cancer arises from the prostate gland, as illustrated here, at a normal prostate. And then here is a tumor, which might be cancer or which might not be a cancer. Okay. Adenocarcinoma is the most common type of prostate cancer. And when you say adenocarcinoma, adeno means it's arising from the cells of the gland. What causes prostate cancer? Up to now, it's not clear what exactly causes prostate cancer. What is known is that prostate cancer begins when cells in the prostate develop changes in their DNA, in their gene. The cell's DNA contains the instruction on what that tell the cell what to do. The changes will tell the cell to grow and divide more rapidly than normal cells do. The abnormal cells keep on continue living when other cells would die. The accumulating abnormal cells form a tumor that can grow to invade the nearby tissue. So, and in time, some abnormal cells can break away and spread, or what we call metastasize, to other parts of the body. So put it more simply, so as with cancer in general, with all other types of cancer, prostate cancer forms when cells divide faster than usual. So it's the uncontrollable growth of cells. Okay. While normal cells eventually die, cancer cells don't. Yan di nakokontrol. So instead, they multiply and grow into a lump or buccal called tumor. As the cell continues to multiply, parts of the tumor can break off and metastasize to the other parts of the body, like the bone. Okay. So who are at risk of having prostate cancer? Men, usually age 50 and above. Then family history of prostate cancer, such as a prostate cancer in the male's brother, okay, father, or grandfather. I highlighted this one with yellow because this is the most important risk factor so far. Genetic is another risk factor, but this is not very common. Then poor diet, unhealthy lifestyle in terms of high saturated fat, red meats, processed foods, obesity, and smoking have also been implicated. And then, of course, the environmental factors like chemicals exposure has also been implicated. So among these five, the most important, the most reliable risk factor is still the family history of prostate cancer in a male sibling or brother, father, or grandfather. So what are the symptoms of prostate cancer? To start with, it can be asymptomatic, meaning no symptoms. It will just stay there and it will just grow there, okay, without causing any symptoms. Or some prostate cancers can grow into the tumors or into a size or into a degree that it will cause symptoms. So these are the following symptoms: needing to urinate more than usual, the urine stream that is slower than usual, weaker, or interrupted, difficulty starting urination or holding back the urine, painful or burning on urination, blood in the urine or semen, erectile dysfunction and ejaculation symptoms, and unexplained bone pain, but with no urinary symptoms, particularly when you say bone pain, unexplained bone pains, usually on the hips and the back. Okay. So these are some of the symptoms that might lead one to suspect the presence of prostate cancer. But we have to make a note here that the urinary symptoms of prostatic cancer listed here, okay, can also be seen in benign prostatic hypertrophy, which is more common than prostate cancer, and also prostatitis or inflammation of the prostate. So they have practically the same symptoms. So one will have to differentiate the benign conditions from the malignant condition based on the symptoms, or using the symptoms, or you might have to do more assessment procedures to differentiate the two, like a digital rectal exam and also ultrasound and other diagnostic procedures. What are the diagnostic tests for prostate cancer? As I said, the symptoms that you see prostatic cancer can also be seen in benign prostatic conditions. So to differentiate the which is which, a digital rectal exam can be done. Example of a positive finding here is that there is a nodule palpated on the prostate and it's hard. Okay, that could be a clue for a prostatic cancer. Another test is the so-called prostate-specific antigen, the PSA. If it's elevated, it could be a signal for prostate cancer, but not all elevated PSA is indicative of prostate cancer. It can also be seen in prostatitis and also in benign prostatic hypertrophy. Imaging procedures like ultrasound and MRI can try to delineate whether the tumors seen on the imaging procedures are really cancers or not. Then, of course, the gold standard in the diagnosis is still the biopsy. Okay, biopsy means getting a sample of the tumor and then examining it under the microscope. So if cancer cells are seen, then you have a diagnosis of prostate cancer. If none, then it's a benign one. What are the treatment modalities for prostate cancer? So depending on the stage of the disease, treatment options include the following. So for the early stage, a slow-growing tumor, you can have active surveillance, meaning no surgery, no radiation, no other treatment, just observe closely, monitor it. And the other option could be surgery, radiation therapy, another option, hormonal therapy, chemotherapy, cryotherapy, and immunotherapy. So the highlighted ones are the more commonly done nowadays. Okay. The treatment decision will be based on a number of clinical and psychological factors, such as patient cancer stage. Kung advanced na, then probably surgery cannot be done. So radiation and other treatment like other systemic treatment like hormonal or chemotherapy can be done. The need for the therapy, kung masyadong maliit, slow-growing, there's no need to have the therapy, active surveillance lang. Then the level of risk, anticipated life expectancy, kung ang pasyente is 90 years old, the life expectancy is less than 10 years, then we don't do that. We don't probably do the active treatment anymore. And the other factors that will have to be considered will be the overall health and also the personal preference of the patient and the relatives. So what is the prognosis of prostate cancer? In general, maganda yung prognosis. For stage 1 to 3, you can see that the 5-year survival rate is nearly 100%. Okay. So kung umabot sa 10 years, the 10-year survival rate is still 98%. In 15 years, 95%. So maganda ang prognosis ng prostate cancer if it's on the stage 1 and 3. Pero pag dumating sa stage 4, medyo bumababa na yung 5-year survival rate to 28 to 32%. What are the screening guidelines for prostatic cancer? So for those age 50 and above, which is the average risk for prostatic cancer, so digital rectal examination would be a minimum examination, may or may not have PSA. So we just have to weigh the pros and cons of the PSA because there's still a lot of controversy on whether to do routine screening for PSA. Then those with a family history of prostatic cancer, of course, the must will be to do a digital rectal exam and also a PSA as part of the screening. Okay. So there's no need for screening at age 70 and above. So pag matanda na at age 70, hindi na kailangan kasi mukhang wala nang benefit. So you'll have more harm than the benefit. What are the screening guidelines for prostate cancer? At the moment, PSA or prostate specific antigen is commonly used as a screening for prostate cancer. Dapat kasama yung digital rectal exam, pero ito yung pinaka-common ngayon. So testing healthy men with no symptoms of prostate cancer is controversial. As I said kanina, the controversy when not to use PSA as a screening tool for prostate cancer. There's some disagreement among the medical organizations whether the benefits of testing outweigh the potential risk, because it can have false positive and false negative results. Another challenge is that elevated PSA can be seen in benign conditions such as benign prostatic hypertrophy and prostatitis. So here are the pros and cons. For the PSA screening and cons for PSA screening. So for the pros, PSA screening may help you detect prostate cancer early. So pag ginawa yung PSA, pag naging positive, no, kung wala kang symptoms, madidetect mo yung cancer na mas maaga. Number 2, advantage of PSA screening is that cancer is easier to treat and is more likely to be cured if it's diagnosed in the early stage of the disease. So this follows the first one. Pag na-discover na may prostate cancer and still in the earlier stage, na mas madaling gamutin kung gagamutin. Number 3, PSA can be done with a simple, widely available blood test. Yan ang isang contention nila. Blood test lang naman yan. Simple lang. Isang tusok lang. Then blood will be extracted for the testing. Now, for some men, knowing is better than not knowing. May mga taong ganoon, pero mga tao rin may mga tao na ayaw malaman. Okay? So we just have to balance the two. Having a test can provide you with a certain amount of reassurance. But I said, kahit na negative, it does not mean totally negative. There could be a false negative results. So, but if it's negative, it can assure you, or more or less give you an assurance, either that you probably don't have prostate cancer, or that you don't have it, or you have it, no? And can now be treated. So yan ang assurance doon. Yan ang advantage ng PSA. Then the last argument for the pros will be the number of deaths from prostate cancer has gone down since PSA testing became available. Now, for the cons of the PSA screening, the disadvantage is that some prostate tumors or cancers are very, very slow growing and never spread beyond the prostate gland. So pwede lang hindi mag-screen, hindi na kailangan habulin kung meron o wala. No? That's the argument against the PSA screening. Then number two, not all prostate cancers need treatment. Kanina sinabi ko, one of the option is surveillance. Pwedeng hindi gamutin. Okay? Kasi very, very slow growing. Some people can live with it, okay, and die of other disease. Okay. Treatment for prostate cancers may have risk and side effects, including ang pinaka-common na mga side effects ng especially surgery will be urinary incontinence, hindi makontrol yung pag-ihi, erectile dysfunction, and then bowel dysfunctions. PSA aren't foolproof. So it's possible that your PSA levels to be elevated when cancer isn't present, okay, false positive, and to not be elevated when cancer is present, false negative. A diagnosis of prostate cancer can provoke anxiety and confusion. Kung may false positive, matatakot lang yung pasyente. No? The concern that the cancer may not be life-threatening can make decision-making complicated. So kung minsan, kung may results, whether it's false positive, decide whether it's false positive, true negative, true positive, true negative. So whichever way, it usually will still invoke anxiety. Lastly, PSA testing has lowered death, but the number may not be substantial to justify the cost and possibility of harm to the person undergoing the testing. So sinabi dito sa pros is that the number of death has gone down, but ang sinasabi dito, is it worth it? Baka it's not enough to justify yung gastos, yung cost of the testing, and the possibility of the harms that can be mga false positive that will be accompanying the treatment, the testing. So the last issue here, can prostate cancer be prevented? Strictly speaking, no, as we don't know the exact cause. If you use that as a reason, we don't know the exact cause, so strictly speaking, you cannot prevent it. So to be practical about it, just best effort, and then knowing the risk factors, no? So you just avoid the modifying risk factors such as unhealthy diet, unhealthy lifestyle, and chemical exposure. Yung sa age naman, it's not a modifying factors. You cannot do anything about the age. You cannot also do anything about the genetic, the inherited gene, and also the family history. No? So sa family history, it's more of the more frequent or may mga screening tests so that you will be able to catch it early. Okay, but in terms of prevention, there's really no way of preventing prostate cancer. So as a summary and takeaway in this lecture, I have discussed all these topics. What is and when is the Prostate Cancer Awareness Month in the Philippines? Current disease burden in the Philippines. What is a prostate? Its functions. What is a prostate cancer? What is the most common type of prostate cancer? What causes prostate cancer? What are the risks of having prostate cancer? What are the symptoms, diagnostic tests, treatment modalities, prognosis, and what are the screening guidelines of PSA using of prostate cancer using PSA? And then can prostate cancer be prevented? So takeaway in relation to patient empowerment, be always in touch with reliable medical information on prostate cancer. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on prostate cancer in your health management. So with that, I end my pep talk today. I hope I have empowered you to have a essential understanding or better understanding of prostate cancer in your health management, among your relatives, okay, your husband, your brothers and sisters, grandfathers, etc. All the males members in your family. Before we go to the question and answer portion, reminder, please take the online Learning Cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. 50 Olete certificates entitled 1 mentee to a free voucher for a ROJoson telemedical consultation. And then another request will be, please type in your feedback in the chat box during the open forum before we adjourn. So let's now have a group picture taking before we start the question and answer and interactions. Please show your beautiful faces. Okay. Ready? One, 2, 3. Okay. The floor is now open for questions, comments, recommendations, suggestions, and consultations if you want. Okay. So any questions, any comments? Do we have anything in the chat box? None.
There is nothing at the chat box.
Who has experience with prostatic cancer in the family? Because I see that all the audience here are females, so we just have to ask, what are your experiences with prostatic cancer in terms of relatives or even friends? Okay. Anybody? Will it surprise you to know that in my lecture I said two things which is not which when heard by lay people they tend to question, to raise some issue. Yung sinasabi kong may mga prostatic cancer can be left alone, no? So ang perception kasi natin is that all cancers as much as possible should be treated, no? So in this particular lecture, it is mentioned that there are some prostatic cancer which do not have to be actively treated. You just monitor, no? Imo-monitor lang, no? Okay. So, di ba kung minsan nakakagulat from a layman's point of view, may cancer, bakit hindi ginagamot? Di ba? Okay. So this is also true in some other types of cancer. No? May mga cancer na mabagal lumaki, pwedeng pabayaan na lang muna, i-observe lang. I mean, say pabayaan is observe lang, no? Not really just leave it, when you say, kasi pag sinabi mong pabayaan mo lang, it connotes something negative. When I say pabayaan mo lang, meaning you observe, you totally monitor without doing treatment, active treatment. No? Okay. So just like it's the same as saying yung mga may flu, kung minsan you don't have to go for your medicine, you just observe, then just rest, it will just go away. So that's the same concept. No? Now, as I said, the second thing that will interest you is the statement that I made that pag elderly patients na, wala nang screening. Huwag na kayo magpa-screen. No? Okay. So ang usual concept is that you screen everybody, di ba? Usual concept. Kung takot kayo sa cancer, gano'n, you screen everybody. But here, there's a statement here that says that if you are age 70 and above, wag na. Na? Kasi kung age 70 and above, let's say a few weeks back, we talked about tanning ng buhay. Tama? We had a topic on tanning ng buhay. Now, and we said that all persons have a limited lifespan on Earth. Kung sa 70, kahit wala kang sakit pa, obvious sakit, limited pa rin ang lifespan mo. So may tanning ka pa rin. Di ba? Okay. So usually, if you base on the actuarial, probably kung 70 ka na, baka hindi ka na aabot ng 10 years or 20 years, no? And then kung magpapatest ka pa at sinabing meron, mag-aalala ka pa, di ba? Baka pwedeng pabayaan na lang. Anyway, probably that will not kill you. No? Probably other things will kill you, yung prostatic cancer, no? Okay. So yan ang reason for saying that at a certain age, you don't need to screen for prostatic cancer or for any cancer. In breast cancer, ganun din. Pag sinabing matanda na yung pasyente, yung person, let's say 60 or 7, I forgot the guidelines, baka 70 rin. Pag 70 or 60 and above, you don't screen for breast cancer anymore. No? Okay, like mammography. No? Okay, so selective.
There is a question at the chat box from Jacqueline Tong. Why is screening not any more advisable for men above 70?
Okay. So yeah, okay. I just saw the question, but I
Yeah.
was explaining it already, no, Jack?
Yes, you did. Thank you. Yes, you did.
Yeah. That honestly, that really caught my attention also, yung age. Usually, although in the past alam ko rin yon, pero nakalimutan ko nga. But when I was preparing these lectures, nakita ko naka-specified 70 and above, wag na. Di ba? So it's true that it's not only for prostatic cancer, but for other cancers, no? Okay. Medyo may edad na because of the limited lifespan, yung natural limited lifespan natin, no? So it's not worth screening anymore kasi it will create a lot of anxiety, problems in decision making, no? Pag may nakita pa, no? At baka hindi man yun magiging cause ng death, yung let's say the newly discovered cancer, it will not be the cause for the death of the person. Pabayaan na lang, no? I-observe na lang. Okay? Any more questions? So who would like to share some experience with the relatives who have prostate cancer?
Doctor, what is the difference what is prostatic hypertrophy and prostatic hyperplasia?
Again,
Prostatic hypertrophy and prostatic hyperplasia.
Okay. So the difference between the two words, hyperplasia and hypertrophy. No? Hypertrophy, okay. Hypertrophy, yung lumaki. Hypertrophy, lumaki. Hyperplasia, yung mga cells, dumami ang cells. The end effect is lumaki rin. Okay? Pero yung hypertrophy, yung lumaki. Hypertrophy, parang yung muscle lumaki. Diba? Pag parang mo in-exercise, no? So you can say it's hypertrophy, lumalaki. Diba? Hyperplasia, may mga cells doon, maraming cells na dadagdagan, kaya lumalaki. No? Okay. So yung cells na yon, usually benign naman din yon. No? Okay. Okay. So kung walang specification that it's malignant, then usually when you say hyperplasia, benign pa rin yun. No? Okay. So kaya ginagamit ng benign hypertrophy, benign prostatic hypertrophy sa prostate, di ba? Benign prostatic hypertrophy, lumaki. Yung sa benign prostatic hyperplasia, lumaki rin. So sometimes they use the two words interchangeably. Pero strictly speaking, there's a difference. No? Okay. Okay.
And what causes the elevation of PSA?
Ayan nga, maraming kaso. Pag may prostatitis, mayroon kang infection, no? It can cause elevation, no? And also, ang kasi nakalagay ng PSA is prostate specific antigen. Hindi naman sinasabi yung prostatic cancer antigen, di ba? Okay. So once you have inflammation, tataas yung yung substance na yon, no? When you have also prostatic hypertrophy, tataas din, no? Na yung PSA, tataas din, ganon. So a lot of times mahirap i-differentiate which is which, kaya kuminsan after one test is not enough. Now you have to have another test to observe kung ang trend is pataas ng pataas, then you may have to do something, no? Okay. Usually mga prostatitis, baka after na ma-resolve yung infection, yung inflammation, bababa na yung PSA. Na? Okay. So BPH, baka tumaas ang konti, baka mag-stabilize, gano'n. No? Or kumisan, buwababa rin. No? Okay. Pero let's say yung PSA, pataas ng pataas, then you strongly suspect na baka may cancer na siya. No? Okay. I don't know how much is the PSA cost. Do anybody know?
Medyo mahal.
Mahal?
Doktor, kasi may nakikita ko sa mga patients when their PSA is elevated and then pag nagpa-ultrasound sila, does it conclude na may prostate enlargement din sila? Are they the same or are they different?
Hindi. Nagkahiwalay yung dalawa na PSA, ultrasound. Okay. Yung ultrasound, you image through the ultrasound machine, you image the size of the prostate. Kaya kadalasan meron ka ring reading na based on the ultrasound, the prostate is enlarged. Di ba? Okay. Or, kumisan, sasabihin nila, may bukol, may nodule. No? Okay. So, now, yung nodule, pag nakita sa ultrasound, usually, pag malaking-malaki, kitang-kita. Pero kung maliit, baka hindi makita. No? Then, if there is a nodule that is seen on ultrasound, i-describe nila kung yung border ng bukol, malinaw o hindi. Kung sabog, most likely they will say that baka prostatic cancer yon. No? Okay. Now, if at the same time na merong PSA yung pasyente na yon, no? Yung PSA na yon is independent yon, no? Okay, independent interpretation yun muna, no? So kung mataas, kasi kung meron kang normal ang ultrasound mo, it's possible that you have elevated PSA. Because there might be something wrong. Baka may prostatitis ka, hindi lang nakita sa ultrasound, or meron ka rin prostatic CA. Ganon. No? Okay. So, kung yung PSA mo, normal naman, you can also have a tumor there na pwedeng cancer. Okay? So, sa umpisa, independent ang reading. Kung mataas, mababa ang PSA, kung sa ultrasound may findings o wala, abnormal, then ibabangga mo yung dalawa, no? Iduduktong mo, no? I-correlate mo, no? Then come out with a decision, no? Of course, one of the decision is usually hindi na masyadong ginagawa yung digital rectal exam, no? Madaling kapain naman yung rectum yung prostate, no? So a lot of physicians don't do that anymore. They just rely on the ultrasound and PSA, no? Okay. Okay. Any more questions? Sinong may relatives? Wala. Talagang no relatives, no friends with prostatic cancer. even with stage 4, ang pinakamasakit diyan pag may stage 4 prostatic cancer, yung mga kumakalat sa buto, yun ang masakit doon, no? Okay.
Dr. Maria Justa Polotan shared this. PSA with ultrasound is 7,000 pesos. Prostate biopsy package is 52,250.
Kung PSA lang, Maria Justa, kung PSA lang, wala kang breakdown? Baka 5,000.
Wala po. Yung PSA always has an ultrasound, I think. So it's 7,000. Kung may biopsy, 52,000. Grabe.
Ano to?
Andito po sa sa Asian Hospital, I think po.
Asian. Okay.
I don't know kung sa government hospital, it will probably be cheaper.
Cheaper.
Kasi, private. Kasi pag private, mahal, di ba?
Oo. Private. Okay. Also, depende kung paano nilang ginagawa yung prostatic biopsy. May package sila, di ba? Baka they use an ultrasound guided, no? Biopsy. No?
So it's, ando na yun.
So,
they have, pag normal yung sabi, yung rectal, that one is cheaper, much cheaper, parang 1 plus lang. Pero walang PSA. Physical exam lang.
Rectal exam, 1,000 na kagad? Okay na.
Opo. Grabe.
Okay. So rectal exam, dapat mura na yung rectal.
I think naman you can have that with your personal physician, di ba ho? They can do that for you.
Yeah, you can have
normally, di ba ho? Pag nag-annual ho, laging may ganon, di ba po?
Hindi ko alam. Kaya nga, depende sa practice ng doctors, no?
Okay.
Minsan, they don't do it anymore, No? Nawawala na yung mga physical exam part, no? Usually they rely too much on technology na
Oo nga po, puro sa tests na lang tapos babasahin lang niya. Reseta. Very few nga ho ang nag-aano.
So rectal exam, basta tandaan niyo, importante pa rin rectal exam. Okay. As part of the screening. Yan ang nakakalimutan mga early diagnostic regimen rather than doing all these tests muna. No? So early diagnostic regimen will be a program, they call it, you can do the usual, the common type, mga rectal exam, no? Ganon. Okay, mapupuna mo kagad kung may bukol o wala, di ba? Kung may bukol, may duda ka na, then that's the time you go one step further, you can do ultrasound, or if you want, you can do PSA, no? Ganon, no? Okay. Okay. Any more questions? Any more input? Nana? Shirley, Tess, any? Is Tess new to us? Is Tess? Tess, do you have any question, Tess? Lopez?
Yes, Doc, she's new. My colleague.
Your colleague? Okay. Meron siyang tanong? May tanong ba si Tess Lopez?
This is my first time, so
okay, good.
I'm just listening.
Okay. How do you like our pep talk?
It's very good. How I wish next time I can attend again.
Yeah, you're always welcome. Now we will run it for another year. at the minimum.
Thank you so much.
Okay, every Saturday without fail, except for
Yeah.
Christmas season and also the Holy Week, Holy
Yes.
Saturday. No? Okay. So the next topic.
you.
Kung may questions pa, you can ask. We still have 8 minutes. But okay, next topic will be on ang tawag doon? About trangkaso and also the flu-like symptoms. No? Okay. Kasi ang daming may trangkaso, maraming may flu-like symptoms. No? So we don't know which is which. No? Is it COVID? Is it flu? Is it whooping cough? Is it something else? No? Okay. So I personally experienced that with some of my patients, no, ng mga telemedical, and also I experienced it on myself last week. You notice that I'm having cough. Hindi ko malaman kung anong meron ako. Is it COVID? No? So lumabas, ang nagpa-COVID test ako, negative. No? So it turned out to be whooping cough. So unusual, di ba? Whooping cough. So medyo nawawala na, okay na. So I'm okay already. That's why I said with these current situations na may mga pasyente may COVID, may COVID ba, may flu, ano bang gagawin, di ba? So ang gulo-gulo, di ba? So that's why I thought of coming out with that topic next week. I'm still developing it, no? So I hope in 1 week's time I'll be coming out with a lecture on that, no? Okay. So, no more questions on the prostatic cancer. Okay. At least you know how to advise your relatives, the male relatives in the family now. No? Okay. So, wala na? Last call? If there are no more questions, we call it a day. Okay. So thank you for listening. Okay, we'll see each other next week again.
Thank you, Doc.
Bye-bye.
Thank you, Doc. Thank you po.
Bye-bye.
Salamat po. Thank you.
Thank you,
Thank
Doc.
you, Doc.
Salamat po.
You're welcome.
Salamat.
Thank you, Doc.
Bye-bye.